Hi, good afternoon from here, from Madrid, from Hospital La Paz. It's Esteban Frauca. I'm work in hepatology and pediatric liver transplantation. The topic for this webinar is going to be a very brief webinar. It's just talking about the latest news in the line of work on clinical audits on topics in pediatric transplantation that the healthcare working group is working on, has been working on, and is going to keep on working. And you know that these audits, it's a line of work that consists in the realization of clinical audits on those considered as relevant topics in pediatric transplantation, with no general consensus at this time in aspects related to diagnosis, prophylaxis, treatment, etc. There's a double or triple objective. The first one is to know what we are doing at the moment at present in the different centers or transplant programs in reference to these topics, to these issues. The second is to do the analysis of eventual differences between centers in the approaches to these clinical issues, might in some way reveal some gaps on which to base research projects, or may establish the need to design clinical guidelines or protocols from the TransplantChild network. And obviously, at the end, there's another objective, that is to produce publications with the results of these audits, and always under the publication policy that it's being defined by the network, looking for the maximum transparency on it. As you probably know, each audit will have two different parts. The first one, which is the proper audit, is a survey about the center's approach to different aspects of the diagnosis, prevention, or therapy to this specific clinical problem. And the second part will be focused on the clinical cases related with this topic registered in the different centers in the last 5 or 10 years. The audit design is a cross-sectional questionnaire. You can see here the upper side. This is the timeline, the process for doing a clinical audit. First, a topic should be selected, normally through a survey, normally in one of the boards celebrated by the ERN TransplantChild in this case. After that, a first draft of this questionnaire is prepared and it's necessary to do an online discussion of this first draft just to get the final document that have to be approved by the healthcare working group members. After that, the final questionnaire is sent to all centers to be fulfilled, to be complete. Once we've got the data, should be analyzed, just to have the first draft of the paper that then afterwards should be discussed for the different members of the healthcare working group, just to get the final paper that will have to be submitted to the journal selected. Well, this is the general approach, the theoretical approach. In the you can see below in this area, which has been the timeline for the first audit we have done. In November 2017 was decided that the first topic in these audits will be the lymphoproliferative disease, PTLD. Dr. Baker was in charge to prepare the first draft of the survey with the rest of the members of the working group. In March 2018, this final questionnaire was sent to the different centers, was an online survey. We start to receiving data from the centers in October 2018, but because most of the questionnaires that were sent back were not complete, we needed to do a second round just to complete responses and so make the data useful for publication, so that there was a long time until we have the final data that was in June 2018. So almost 2 years after we start with the first steps in this clinical audit. Well, I think was really positive that at the end we've got results, we've got answers by 35 programs from 15 centers. In 12 centers fulfilled the survey and sent clinical cases, and other 3 centers only fulfill the survey, but they don't consider to send cases. In the last August to September in this year, Dr. Juan Torres have done the data, the analysis of the data, and this month of October, Dr. Juan Torres with Dr. Baker, with the collaboration of Dr. Baker, have prepared the first draft of the paper. At this moment, this first draft has been sent to the different healthcare working group members to be discussed, to hear from them their comments, their suggestions, whatever they think that can improve the quality of the paper. The plan is to submit the final paper the next weeks to a journal, and the first journal that has been selected has been the Paediatric Transplantation. Well, I think we have learned some things with this first audit, with the PTLD audit. The main strength, I think, we think it has been the very high participations of centers and programs, what in some way reveals a real involvement, a real commitment by the centers with TransplantChild, with our ERNs. Again, 35 programs from 15 centers have participated in this audit. And one of the most important results of this contribution has been that we have harvested 130 PTLD clinical cases. That, as far as we know, is one of the, in numbers, one of the most important series of PTLD cases in pediatric transplantation. But on the other hand, I think that the main weakness in this first audit has been, as I have told you before, is that it has taken us a long time to obtain complete responses by most centers. So I think it's a lesson to learn for future, for the next audits, and it will be really great to employ less time to receive this data, to receive the responses. And I'm sure we are going to get it. Well, this is this slide. You can see in some way the progression of this first audit on PTLD. On the left side, you can see what was at the moment the first draft kindly prepared and kindly submitted by Dr. Baker to us, to here, to the coordination of the network. In the middle, it was the final questionnaire that was submitted to all centers to be complete. And on the right side, you can see which is the first draft of the paper that has been sent to the members of the working group to be discussed and to be complete. Well, I think it's express the steps we have done until now, until this moment. Well, if I want to summarize where we are now in this line of work that are the clinical audits. So in reference to the first audit, the PTLD one, we are now discussing the paper draft, and the plan is in the next weeks to have the final paper to be submitted to a journal. The first idea we are going to try is pediatric transplantation. This is line of work, so the plan is to keep on doing these clinical audits because we think we have reasons to do that, and we think they are going to be useful for everyone of us in the network. So the second audit, it was decided in the last board of TransplantChild that will be on vaccination in pediatric transplantation. There will be a first part with questions on vaccination practice, and a second one on clinical cases with preventable infections in the last, well, maybe 5, maybe 10 years in the different centers. We want to harvest these clinical cases you have. Well, the first step will be to prepare the first draft of the questionnaire, and in this setting, it was offered to our colleagues in Padova, in the Hacienda Ospedaliera di Padova, to prepare and to present this first draft of the questionnaire in the board that is going to be held in Padova in November 2018, in 2 weeks, 11th and 12th in November. We want to discuss this first draft of the questionnaire in situ, and afterwards we want to have an online discussion with the rest of the centers or everyone interested in this topic, vaccination in pediatric transplantation. We would want to have the final questionnaire prepared in January 2020, so that we will be able to send to all of you in the centers to fulfill the questionnaire and follow the same steps that I have shown to you that were taken in the PT-LEAP audit. So I don't know if there are any questions for me at the moment. Well, this webinar, just exactly as the other ones, will be uploaded in our web page, TransplantChild, so that it will be available for everyone to have a look on this webinar and make questions you consider. Everything about this new audit will be open for discussion, for suggestions, for comments, for everything you consider will be useful to do this work. Thank you very much.